Okay, in this video, I will be going over an amalgam tray setup along with the restorative instruments and their role during an amalgam procedure. Okay, in order, we first have our mouth mirror, which allows indirect vision by the operator, and you would need two placed on the tray. Next, we have our explorer to check for smoothness and to remove excess amalgam from the tooth structure. Here we have the perio probe, which is to ensure appropriate dimensions of occlusal extension and evenness of the pulpal floor. Next, we have our cotton pliers, which is to pass and retrieve objects. It's also used to contain leftover amalgam. Here we have our spoon excavator, which is used for removal of soft dentin, debris, and decay from the tooth. Going along, we have our enamel hatchet, which is used for retentive areas, internal line angles, and removing hard caries. Next, we have our mesial gingival margin trimmer, which is used to create bevels on the mesial margin of the preparation. Here is the distal gingival margin trimmer, which is used to create bevels on the distal margin of the prep. Next, we have the acorn burnisher, which is used for smoothing the amalgam after condensing. Shown here is the ball burnisher, which is also used for smoothing the amalgam after condensing. Next, we have the tanner carver, which is used to carve occlusal anatomy into amalgam restorations. Moving along, we have the half Hollenbach carver, which is used to contour and carve occlusal and proximal anatomy in amalgam restorations. Shown here is our articulating paper holder, which is used to hold the articulating paper in place and to check centric and lateral occlusion. Next, we have our gold carving knife, which is used to trim proximal restoration. Here we have our matrix band, used to replace missing proximal wall or walls of cavity preps for condensation of restorative material for class 2 preps. Here we have our amalgam capsule, which is used to mix permanent and temporary cements and to mix alloy and mercury into amalgam in a capsule. Shown here is our amalgam well, which is used to hold amalgam before it is placed in preparation and to hold amalgam while loading the amalgam carrier. And the amalgam carrier is to carry and dispense amalgam into cavity preparation. Next, we have our anesthetic aspirating syringe, which allows the dentist to aspirate the injection site by pulling the thumb ring outward. Here we have the dental scissors, which is used to cut oral tissue during the procedure. Next, we have the wooden wedges, which is used to hold matrix band in place along gingival margin of class 2, 3, and 5 preparations. Of course, we have our Patterson topical anesthetic gel, which is used to aid in painless anesthesia. It's always good to have a scrap amalgam container to store leftover amalgam waste. And that is an amalgam tray setup.